Okay, well, I've established an office, a office which is focused on oral health, and whether it be in prosthodontics or in general dentistry, my focus is to be able to get people healthy. Well, the oral cavity is first of all is the gateway to the body, both from a psychological and behavioral point of view as well as a physiological point of view. What goes on in the oral cavity, which is very dynamic, influences what goes on in the rest of the patient's body. The LANAP protocol is an advanced technology. It recognizes the science. It recognizes science behind its procedures, and is the way to go for the future of clinical practice. This is a protocol that, in a very non-destructive way, is a very powerful way to motivate patients for their oral health. The changes are dramatic. The patient involvement with this is significant, and it addresses itself to those kinds of people that are interested in their overall health and in their oral health. Unless these are particularly people that are being referred to periodontal offices. And since we manage our patients both periodontally as well as restoratively in the office, they have to be educated, which is part of the mission of the office. So in the beginning, they are not so much skeptical as they are wait and see. But post-treatment, recognizing what's been done for them and how comfortable they feel, and the results in terms of how their mouths feel, and even some of the more long-term effects in terms of just maintaining things, they feel good about it. They feel good. But the world of technology in terms of medicine, which includes dentistry, is dramatically changing. And that if you're interested in having procedures in your office that will really help people and do it in a reasonably non-destructive way, then this is the way to go. But my incredible case is the man that walked into the office with an implant in his hand, or stuck into his jaw, but really it was removable. And I don't think implants are really designed to be removable. And at this point, we've treated this. At that point, I actually hadn't taken the fourth day, and I'm still a little bit nervous about unstabilizing this. It's like in a splint. But on the X-ray, there's no question that there's bone around this implant. So it's win however it comes out. I mean, the radiograph doesn't lie. And I've shown it to colleagues and shown it to the office staff, and we just sit there shaking our heads and saying, we really want to see what happens when we take the splint off from this. The training program here, I believe, is actually very, very well done. First of all, there's a sense of respect the way people are treated. There's a sense of repetition. There's a sense of seeing this in a very professional and in a very, I won't say the word is not academic as well as much as that is scholarly manner, that this is not voodoo, it's not something that's sort of off the wall, and that not only does the literature here support it, but there's more and more literature being described in general about the value of lasers in health in general. So this fits in very, very well, and the way the program is run, you really feel like you're doing, I guess the word is a medical procedure, a procedure which is not so much drill and fill, but it's really a healing procedure. As I said, I feel very privileged about the opportunity to be able to work with this and its flexibility and the things I've learned about lasers in general and the use of this laser with particular value with managing periodontal disease and soft tissue disease in the oral cavity and around the oral cavity is very good, and I'm very happy I can utilize this and help my patients and myself.